Assalamualaikum and good morning. I'm Hanita, second moderator for the next speaker, for this speaker. Okay, I'm sure that most of the nurses know this speaker. So it is my great pleasure to welcome our distinguished speaker for today, Professor Dr. Khatijah Abdullah. Okay, for your information, Prof. Dr. Khatijah is currently the head of the Department of Nursing at Sunway University and previously served as the head of the Department of Nursing Science at University Malaya. She holds a doctorate in clinical practice from the University of Southampton, UK, and has extensive experience in nursing education, clinical practice, leadership, and also research. She has supervised to numerous postgraduate students, include me, served as examiner for many master and PhD candidates locally and internationally. And she also actively contributes to curriculum development, accreditation, and nursing professional bodies in Malaysia and also abroad. Professor Dr. Khatijah is also widely recognized for her contribution in nursing research with extensive publication in areas such as mental health status, cardiovascular nursing, nursing education, patient care, and also healthcare quality. Today, she will be delivered talk we entitled Our Team, Nursing Team, Our Nurses, Our Future, Empower Nurses, Save Life. So please join me in warmly welcoming Professor Dr. Khatijah Abdullah. Prof, the visual floor is yours.
Thank you so much, Dr. Hanita. I'm so happy to see you. And a very good morning. Assalamualaikum, ladies and gentlemen. Hanita, can you hear me?
Yes, sure.
Excellent. So thank you for the Faculty of Nursing, University of Malaya, for inviting me to join in to celebrate this very significant event, the Happy International Nurses Day, from me to all of you. So just give me 1 minute. I'm going to share, finger crossed, share my slides. It should be, yes. Okay, I need to, just give me a second, yeah? Excellent. Okay, can you see the slide, Hanita?
Yes.
Excellent. So, like Hanita have kindly actually shared with you, I'm actually a nurse, die hard, really, because that's all I know what to do. And I fell deeply in love with it since I was a teenager and still in love with it. So I wish all of you the same journey and the very, very exciting journey ahead of you with all the changes in front of you. So from my School of Nursing in Sunway University, we wish all of you, each one of you, a happy International Nurses Day. I know it's yesterday, 12th of May, where the birth of our Florence Nightingale, but it's never too late, really. So happy Nurses Day. So just to share with you, I actually came from a Faculty of Medical and Life Sciences in Sunway University, where we have 4 schools. Nursing is one of the schools, and with 4 research centers. My dean sent his best wishes, and he opened our door to you, all of you. Anytime, any day, you can get my contact from Hanita. You can always drop by to look around and have a cup of coffee and share exciting nursing ideas and stories. So the welcoming address is from both the faculty and the school. We do have programs that you may be interested in. We're a total of 14 taught programs and 8 postgraduate research programs. So if you are interested, do go to our website, right? So we're not as big as University Malaya, but we're trying our best. I would also like to acknowledge the contribution from Nursing Board Malaysia, which I pinched from their recent presentation from our Dawn, Matron Gauri, in one of the recent conference last week. However, I also would like to tell you is that whatever I share with you is only the tip of the iceberg. There's so much out there for you and me to explore, and I hope you will do that. Now, as you all know, the ICN team for 2026 is about empower nurses. So I'm so sorry. My main gist will be on empowerment. Now, you and I know we learn about empowerment in the concept of nursing. right? It's nothing new. So I'll try to bring new perspective into it, right? So let's go forward. Now, this is a very old slide, but all of us know that there's a worldwide economy threat that WHO, our own health minister, have already predicted that we will have a shortage of nurses. So what is that to do with empowerment? Let's go forward. And the latest news from Nursing Board recently, which they actually captured and actually shared during that last week conference in Sunmet Medical Center, that there has been a very significant increase in nurses resigning. As you can see, since the COVID 2021 post-COVID pandemic era, we have 200 odd. But come 2025, November 2025, we have over 600 nurses that is documented that have left nursing. Now, you and I know there's lots more there that haven't reported that they have left nursing. So this is actually a very small number on paper, but the increase is 3 times. That is very concerning to nursing profession. So, of course, why do people leave? There's a lot of reasons. I'm not going to go into all of it, but I know most significant factors will be burnout, uneven distribution, aging population, and of course, the workforce shortage have actually affected you and me. This is actually very true. And in Malaysia itself, we do have past policies and present crises that actually lead us to a legacy of underinvestment. Now, when you are underinvest, that means money less go to nursing profession. And that is where we have to think about it, the root causes of our nursing problem. So I can share with you the past moratorium where, we have supply constraint, we closed down nursing colleges, and so that actually affected our output of nursing. And then there's a wage war with our neighbor, Singapore. And of course, don't talk about Saudi and Brunei, right? And the third one, the high turnover. A lot of nurses are leaving for the better pasture out there. So the ICN strategy plan, if you look back internationally, the ICN, the International Council Nurses Strategy Plan from 2024 to 2028 is actually designed to empower the world's largest workforce, that's you and me. And one of their factors are to protect and invest, looking at sustainability and the underlying platform. Now, addressing well-being, safe staffing, all these are important factors to encourage empowerment. We will go into empowerment in our following slides. And to summarize it, we do have a triple return if we actually address staffing and empowerment, because we will have better outcome, we have better economic growth, and we will have a stronger health system. So is it just what I say, or what you read, or what you see? So where's the evidence that says that it's so important? So I would like to actually share with you 3 articles to actually highlight and remind us how important it is to have at least the basic staffing and qualified staff in order to be able to voice out and have a say in our patient outcome. Now, out of these 3 papers, 2 are actually review. Unfortunately, there's a lot of review papers on this subject rather than active original research. However, I did find one, so it is still, there's some evidence for you and me. Now, this is actually done in 2023, quite recent, and they actually look into 23 studies, and they conclude that if you increase proportion of registered nurse, there will be improved outcome and definitely reduce costing. So this was actually done by Peter Griffins et al., and they actually looked into the review of all these papers. Now, the second one, actually from International Journal of Nursing Studies, it was actually published in 2022 by Dora, and the 2021 by BMJ Open. Now, both of these papers, one is actually talking about review and highlighting that if you have staffing levels increase, it will actually have a beneficial effect on your patient mortality. Now, the 2022 paper is actually an observational study. So it's the original studies, and at their studies, they actually found out that with increased staffing levels, you can increase the odds of death by 16%. That means the mortality rate actually do decrease if your staffing level is better. So this is all evidence that says that staffing is important. So let's look into why then empowerment? How is the connection going to be? Now, I would like to share a very small story that I'm sure you have come across. Okay, so just say Amina, a junior nurse, noticed that her patient didn't look right. Everything is acceptable. The vital sign did not show any deterioration. And everyone's just say, well, everything looks okay. But the nurse trusts her knowledge, experience, and gut feeling. Even though she was nervous, because everybody said, why are you jumping up and down? She spoke up. And minutes later, the patient suddenly deteriorated and actually required emergency intervention. The doctor later said that if the nurse had not acted early, we may have lost the patient. Now, what I want to highlight here is that you need a nurse to be able to identify and alert people early, because we are backbone of the nursing profession. We cannot run away from it. And this is actually difficult to do, to speak up, and you need to be empowered to do that. Now, having a nurse is a body, but if the nurse just get quiet, is it going to make a difference? So staffing is important. We can have thousands of nurses, but if they're working as if they're robots and they're not empowered, nothing is going to change for our patient in terms of patient outcome, in terms of mortality and morbidity rate. Now, all of us went into nursing because we want to do good. We do not want to do harm. We are not supposed to do that. However, if we do not speak out, we might be doing more harm. Right? So this is why in this scenario, that nurse, a junior nurse, saved a life. Not because she was the most senior, she's having PhD or masters, but because she dared to speak up. She actually know that she needs to speak up, but because she was really able to think, able to advocate, and she was empowered. And that's why empowerment matters. It's not the quantity, it's the quality. And this is where we're going to go deeper in. So what does it actually mean to nurses? I think for me, empowerment means that if I'm empowered, I'm more confident. I can actually feel more comfortable being involved in decision making. And I actually felt that I can learn and grow. And this actually led me to advocate effectively. And that's what we want our nurses to be, not just a number. I think staffing number is important, as the evidence show, right? But what type of nurses? So I talk so much, I hope I brainwash you to think that, oh yes, empowerment. So, but is there evidence? What does people say? Again, I would like to share with you 2 reviews and 1 original paper, right? So this one is a very, very recent one. And this is actually done in BMC Health Service Research by Lee et al. In 2026. Again, it's a review, but it's a 37 studies review involving nearly 20,000 participants. And although this review studies is predominantly cross-sectional, it's not the golden standard of RCT, it actually definitely conclude that higher employment associated with higher nurse job satisfaction and lower emotional exhaustion. It is what keeps the nurse going. This is what keeps the nurse not to be burnt out and actually leave nursing. I think this is a very important look at how important empowerment is. Now, the second one is actually under International Nursing Review. As you know, International Nursing Review is the ICN journal, right? And that was actually done in 2023. Again, quite recent, I would say. And they actually, again, look into a review and a meta-analysis on empowerment and burnout. And again, from all the studies they actually review, they actually concluded that this study demonstrated empowerment is associated with lower emotional exhaustion, which basically supported by Lee et al. There's an improved personal accomplishment, a personal satisfaction. So the third paper is actually a very small paper, but it's an original paper, and this is by Kelly et al. And they actually did it on critical care nurses, only 83, so you can actually see the flaws in it. But it actually used 3 instruments, all validated instruments, and they found that empowerment reduced nurses' intention to leave, and empower nurses more likely to remain in profession. So we save a lot of cost training students, nurses, if our nurses remain at the job. So that reduces costs and definitely empower nurses. The previous job reviews already highlighted, they are more satisfied. So why not? So let's come back to Malaysia. We look at all globally review. Now, the recent conference that was presented by Matron Gauri, our Director of Nursing in Malaysia, actually shared this Transforming Nursing in Malaysia, a 10-year strategic road plan or roadmap for 10 years. Now, I must highlight that you would not find it online. I actually snapped it and actually try to share it with you. I snapped her presentation because it is actually not out there in the website yet. There was some hint about it. So there's a 4 pillar. The first pillar is on job, second is on service, third is on education, and fourth is on leadership. As per share with you by Prof. Dr. Demayati, how important leadership was. Yes, so this actually, this roadmap was actually a mandate that to transform a nurse from being just functional, just doing, into a more national health reform. We are not supposed just to do, we must move forward. And this roadmap was based on 2 very important papers in Malaysia, which is a Health White Paper 2023 and the Future of Health Workforce, which was also recently published. And this in 2025, basically. And all this, if you looked at these 2 papers, their original focus is really on workforce. You know, shifting closer to communities, having a better workforce, and also structured career pathway, looking at expanding digital health. So basically, we are focusing on the resources, the human beings. And this is so important because nursing is very task intensive. It's very orientated to patient needs. So the next few slides, I'm actually going to be quite fast with it, right? But basically, the gist of it, pillar 1 is talking about how do we want to retain and how do we want to expand our number of staff nurses. How do we improve on the quality of our staff nurses? So sustainable workforce is not only just a workforce, but a workforce that actually creates effect. Right? The pillar 2 is about the service itself. What can we do better with our service? So with the innovation, with our rising NCDs, conditions, with what you call it, moving hospital at home concept. So our service delivery have to be revamped so that we can deliver high quality. The pillar 3 is education. That's where me, and I'm sure Hanita is now in education, is to ensure we have future-ready workforce. That basically makes sure that our workforce are aligned, they are accessible, they are specialized, so that the competency and the knowledge is all there. The last but not least, as our first speaker says, definitely nurses is to move from bedside to boardroom. This statement has also been highlighted in the National Council of Nurses website. So we need to think about having good leaders. Now, I think having good leaders is not one person's job. All of us are leaders to our juniors. We are the role model. If we do not do right, how can we complain about our junior? So I think it's very important that we must move away saying that, where's the leader? Where's the leader? Why don't we say, where am I? You can be a leader. As a team leader in a ward with 28 beds or 48 beds, you are the leader. You guide. You become the role model. So basically, from bedside to boardroom, everybody can be that person. Not only the ward manager, not only the Don, the director of nursing, and not only a professor. So these are the 4 pillars. Now, shall we have some fun? Which I got 10 minutes. Do you want to scan the QR code? Because I would like to find out from you what empowers nurses the most. I'm sorry, I make it very quantitatively. So I have given you very structured points. So please vote. For this, you can only vote once. Just find what you think empowers nurses the most. I have checked it and it did. Let me do it. Hanita, let me know if you can't do it, then I'm sorry. I see the chat, so you got a lot of people telling me something. Oh my God.
Cannot, Prof, because I also try to access.
Oh, selected cannot access.
Microsoft
Oh,
account, they must have that.
so my apologies. I thought we have some fun this morning to wake you up. So I'm so sorry you can't do it. I do have 2, so just ignore that. Shall we move forward, Anita?
Yes, can.
My apologies. So let's, okay, my next slide. Now hang already pula. Okay. Right. It won't, wait. I tested it, it did, wait, maybe I can only, okay, data now, I stop sharing, don't worry, I'll come back, okay? Because I need to go back to that.
I'll just wait for a while. Prof Katie will share the slide again.
Yes, I only got 2, 3 slides, so no worries. I know I've taken a lot of your time. Oh my God, where is it? Yes. So I am in that. So I'll get away from there. So I'm going to share this straight away. So I'm sorry about this. My sincere apologies. And let's go on. Okay. So definitely it looks very nice and cool to be empowered, to be able like the mini lawyer in the clinical area. But there is also constraint because of the workman shortage. You have nobody. Actually, you need also adequate staff to support you. Now, if you are very one voice, it's not going to be powerful enough. That's why empowerment comes, if possible, with more than one voice. You need to be a very supported community that actually would listen to you and acknowledge that you have something to share. So that is where supportive environment is one of the factors to encourage empowerment. So obviously burnout, if we are really, half dead from all this stress, you're not going to voice up for anybody. And there's obviously also the stress factor, the resource limitation, and also limited leadership opportunities. Most time people unfortunately look at the DR, the medical doctor. The nurses are secondary to that. That is a society that we are facing. But as we know, we have to move forward and to change mindset, right? So this is another one which I'm not going to do too. I'm so sorry that you can't do it, but never mind. I would think of ways to share that with you, with Hanita, right? So strategies, my last 2 slides is we have to have continuous professional development. Now, all of us do it, right? We must have opportunities to be a leader and again, a workplace culture. Now, it is also not right to say that we have a toxic culture, Kati. But if you think about it, the workplace is you and I working in that workplace. Who caused it to be toxic? It's you and I. So maybe when we commented that that is a very toxic environment, we should examine ourselves. Did we play a part to make it toxic? Because environment is a thing. It's the people there that makes it supportive or toxic or nothing, right? So there's a lot of things that we have to take ownership. Of course, well-being is important. If we are mentally challenged, there will be problem. Yeah, collaboration, which I think Dhamma Yati actually have highlighted. So my last two slides. If all of us very quick to say nurses are the backbone of healthcare, then why are we still asking nurses to carry the system unsupported? Are we investing enough? Are nurses truly included in decision making? Are we empowering our nurses, our students, or merely expecting them to be resilient, to be able to cope? Why do we need to cope when we got a voice to be involved and to actually create a better world? So what kind of healthcare future do we want for the next generation? I think this is so important for educators like me and Hanita, because definitely the next generation will be taking over, and we at the era where we have to actually give in. So the future of healthcare depends actually not only on technology or infrastructure. You have a lot of nurses, but they are not being supported. They are not happy. But actually, it's definitely very true. How well we empower people, how do we make them feel that they are part and parcel of the organization? Because when they're part and parcel of the organization, their voices are heard, they can lift up the hate and very confidently play a part. And I believe when nurses rise, healthcare crisis will go down and healthcare quality will rise with that. Because we are the most number of healthcare professionals. So together, let us think about empowering our nurses to strengthen healthcare and to transform our patient life. That is what we want to do, transform people's lives. But are we talking too much and not doing something more? I leave you with that. So thank you so much. And again, my apology for the technical. I was so sorry about that. I try my best, but I will improve on it. Okay. So thank you, Hanita. I'll pass back to you and I'll stop sharing. No worries.
Thank you, Prof. Katie, for the inspiring and meaningful sharings. Yeah. Okay. Now, I would like to open question to the audience. If you have any question, you can raise your hand, and also maybe you can type in the chat box, or maybe you can share your opinion towards empower nurses.
Yeah, I would like to chip in. I think I just saw the chat, and thank you very much, Miss. I will say your name. Oh, well, your name is there, Miss Tanya Wasri, and her very good question. And I would say it's a 1,000,000 questions that worth. How do we empower nurses when we have leaders with low leadership skills or toxic leadership? Now, again, I would say that don't look at them. If they have actually low leadership skills or they are toxic or whatever the word password is, basically then, why are we depending on them? Why can't we ourselves start something? You are a nurse with the same training like your leaders. They also been trained as a nurse, right? Only that maybe by luck or by their qualifications, they get the position that they obtain. But that doesn't mean that you cannot be the leaders. Now, leaders are not a title. You do not need to be a title given to you. Oh, you're the manager, so you're a leader for this ward. I would emphasize is that how do we empower nurses when we have leaders? I would say that you yourself empower yourself, and by that empower other nurses working with you. Now slowly the environment will turn the tide, because there's only one leader and there's so many of you. One toxic and so many of you are positive. What do you think? Right? So do think about what you can do. You cannot change people. I come to nursing knowing that I cannot change people, but I can try to mold them and show them by role model, and I try not to be like them. And I think that works usually. Yeah. So what changes should nursing education implement to prepare graduates for future healthcare challenges? I'm still looking for the what is it, the grind, the answer. But I feel that nursing education, we need to work, we need to be working with our current generation. We cannot change them. It's no use saying that, no, last time we are not like that. Well, they are not you, they're not me, unfortunately or fortunately, because I think I don't want to have a mini Khatijah anywhere either, because they are such low quality of life, working, that's all they know. I wish I would been encouraged to be more holistic, but I'm a very bad example. So I felt that as a nurse educator, we are not to change, not to change people, but to show them the way. And to show them the way, we have to walk the journey with them. You cannot just drag. You have to walk with them and show them the steps. So definitely for this generation, a lot of patience, a lot of hand holding, right? A lot of changing our mindset that these are people who are unique by themselves. They are not us. No use comparing. And it's very unfair for us to compare ourselves with them because we are looking at hindsight retrospectively. Now, these nurses are now dealing with 17, 18. I can tell you, there's so much I learned from them, but so much I also enjoy when I walk with them. Yeah. So I hope that actually is our mindset. The changes that I think we should think about is having educators and also having a flexible curriculum. No longer 9 to 5, more innovative actually to actually stimulate their interest. Okay, how can we evaluate? Last question. How can we evaluate an education program? Right. I think as you know, where is that? How do you evaluate program? I think education program evaluation is already held by our nursing board. And I think we have to respect that. Someone has to be the bad guy. And there's no right or wrong way. Is good to have one way so that at least there's consistency. I'm not saying that one way is correct, right? But you need to have guidelines. That is very, very important. And positive psychology, yes. If you yourself are condemning everybody, condemning nursing, it will just go on condemnation. No light at the end of tunnel, right? So we have to empower them, and that include being resilient and coping. But I think the most important thing is that you can be resilient, you can have coping strategies. That's for yourself only. What about nursing as a profession? So I think we have to think about not only coping ourselves, but used our connection with people to build the resilience and also to build our coping mechanism. I think I have to give back to Hanita. Hanita, sorry, I'm taking over.
It's okay, Prof. We can end until 9:15 because this is a Nurses Day. So FOM, we give a special time for us, yeah, because we can see that the active participation from the audience, yeah.
Thank you so much. So I hand it back to you.
Okay, Prof. I have also one question because you said that we have to empower nurses, and from we can see that the current issue, too many nurses leaving, too many nurses resign, close of the nursing college, yeah. So from your experience as nursing leadership and education, what changes that mostly urgent needed in measure to strengthen our nursing profession?
I think it boils down to the root causes. Now, future nurses come from student nurses. Student nurses are being molded by educators. Of course, you're going to tell me that, yeah, I tell them everything, but they still behave the way they are. Then we have to examine, did we tell them enough? So I feel that if you have no good nurses, you can never have good leadership, because leaders is from nurses, and nurses, how they train and how they perceive nursing is important. And actually, when I first came back, I'm a very clinical nurse. I want to be in the ward because I like to be with patient. I talk a lot. That's why I like to be with patient. I can talk with patient. I can talk with relative. I can talk with doctors. I can talk with nurses. Right here, I only talk with my colleagues. So I didn't like teaching actually. But I came to the state that I felt that one clinical nurse can only do so much. But if I owned it and train an army of nurses,
Yes.
they will be my deputies, they will be my soldiers to change the future. I really, with that intention, I actually then decide, yes, I have to go to education, because when I came back and go to the clinical ward, I tak boleh tahan.
Yeah, yeah.
And I was not empowered because it's in 1990s, and I got one voice only. And I look left, look right, all of them so quiet, so goody, and I'm the one who is the black sheep. So I said, no, something has to be done. I cannot expect a trained nurse who already got 3 years, drum into the head, you must follow orders. And I come in and say, please change, please be empowered. They won't listen to me. So I then think that, yeah, education, hopefully, inshallah, I can change people. And I hope that when I'm sick, in front of me is an empowered nurse that dare to fight for me with the doctors. And not say fight lah, maybe reasoned with the doctors.
Brilliant, yeah.
Yes, and I need that. I need that nurse, because if I'm sick, I can open my mouth, even though I feel with knowledge that, hey, this is wrong. But just say I got a stroke. I cannot open. I depend on you. And I'm so scared, actually. I'm really terrified, because I am at the age where anytime I may go to the hospital. It's only by God willing, alhamdulillah, that I still active. But I know the day and the time will come, and I will need you, Hanita, to look after me. or all the nurses out there. And if I don't train them well, how? So I think training comes first, then you can build leaders. Leaders are not all born. Unfortunately, we do not have a natural leaders like Tun Mahathir, who can be very charisma. Sometimes we actually develop our leadership. Most of us do that because, unfortunately, 1 out of 1,000 only may be born with the gift of the gap. Can talk well, can convince people. Yeah. So I hope that answer your questions, Hanita.
Yes, was okay. Prof, just to share with you, for your information, all the audience sometimes, all the audience we can see from the Indonesia, we have from the China, yeah. And I
Alhamdulillah.
see that maybe your former student here, yeah.
Yes.
So
Thank
happy
you
to
so
see them
much.
through visual. Okay, all right, Prof, on behalf of UMHealth and our Faculty of Medicine, Yusufaya Faculty of Nursing also, we would like to express our sincere appreciation for your time and valuable contribution today. Yeah. So to all participants, thank you for joining us this morning. Yeah. Happy International Nurses Day to all nurses and future nurses. Yeah. Stay safe, stay inspired, and also have a wonderful day indeed. Okay. Thank you.
Yeah.
Assalamualaikum.
Waalaikumsalam. And thank you very much, Hanita. You did very well, and I'm so proud of you. And it's so nice to also hear from Prof. Dr. Damayati and also the chair, Dr. Nadika. All of you is my student. So I'm so proud because I can see you growing, maturing, and the way you are so professional. So Alhamdulillah, I think I did something right.
Okay. Thank you.
So continue shining and continue good work. And who knows, one day we'll meet again. And please know that I'm always behind you. If there's anything I can be of help, I will try my best. Right? And if there is a need, do contact me. I'm always there for you guys, especially my students. Yeah? So take care. Happy International Nurses Day.
Happy.
Bye, Dr.
Thank you so
Damayati.
much. Thank you.
Bye,
Dr. Nadika.
Hanita. Bye, Natika.
Thank you so much,
you.
Prof.
Bye.
Bye.
Bye, everyone. Wish you a good day.
Yes. Bye.